recording for this meeting. So if your colleagues will miss something, they will be able to see this recording. Okay. As always, please feel free to write your questions in chat, and if you have anything to add, anything to ask, you are totally welcome. Okay, I will share my screen now. Here it is. Just my environment. I hope now everything is fine. Okay. Open chat. Good. First of all, thank you very much for active participation in working in this spreadsheet, because it is much easier for me to find all the details about you in one place, and we can always go through and check all the details on your work. And I suggest that we will continue with not only presence in class, but also in detailed participation in discussion about your papers. Okay. So I was going to start with how to create a title, but right now I see that some of you are totally okay with this task, and it's not required. So I will be very short on this topic, and in general, it's not difficult, and I hope it will not be a problem. Today I have some illustrations for this question. First of all, we need to say that we are writing a scientific paper, yeah, and this scientific approach, which we are using in our work, is based on scientific method in general, and I hope it is familiar for you in your previous work and other tasks, and it's based on some observation. For example, we just have a short discussion in WhatsApp with one of the students that, for example, we observe that we have a shortage of doctors, yeah, and we are starting to think about how to solve this problem. And so we address our interest in the area of telemedicine and telehealthcare and everything about this topic. So it will be our area of research. Next step, we start with hypothesis that if we will introduce telemedical services, it will help to improve our healthcare system, to provide better help for our patients in the situation when we do not have enough doctors. And why it's not why is it a hypothesis which we need to prove? Because it's not so obvious. In many cases, if we will approach our doctors and say to them that you are not only going to talk to your patients face to face right now, but also you will have a computer, and time to time you will have pop-up messages from lots of patients in different regions, in different cities, countries, and all of them will ask you difficult medical questions. And now you have to, without any rest, keep all your time occupied by answering these questions and making these appointments with face-to-face patients at the same time. And everybody will be very unhappy in this situation. And we need to elaborate on this topic. Now, how exactly this telemedical services will help, and how they are able to reduce this pressure on doctors. For example, it could be a reduction of face-to-face visits when we do not need to see our patients to, for example, make a prescription, to measure blood pressure or something else, which could be done easily at home. And this is one of the ways how we can reduce this pressure for doctors. And there are a lot of different examples how it will exactly help here. For example, we can use devices which are gathering medical data automatically without consultation with doctor. We could introduce artificial intelligence which will advise doctor on the exact situation based on all the previous communications with this patient or something like that. So it's a very interesting area to discuss. It's not a statement that this telemedical service, of course, will help, but we need to be more specific how exactly it could help. And as something to start with, we are able to go with a paper describing in theory based on publications in other papers. It will be a review, and it's totally okay to make a review when we will find other publications which describe how telemedical services helped in other regions, other countries, other situations, and we gather all this information, analyze this, and this will be our test and experiment. It will be data from publications analysis. It's the same as our own experience. In many cases, it is more useful than our own experience because it's based not only on one case, but on multiple cases. But if we are talking about practical jobs, when we're able to make an experiment, for example, we could measure how long it will take to collect data from blood pressure from patients with telemedical application and with face-to-face visit. And we are able to calculate, will it help to reduce time for each patient visit or not, something like that. Of course, it's just an example, yeah? I am providing you an idea how it could be done. As a next step, we will need to analyze this data. Data analysis in review will be gathering of examples from other publications. Was it helpful or was it not? We were able to find different categories of telemedical services and were able to analyze each category separately and gather evidence, was it useful or not, provided benefits or not, and analyze all this data. In more experimental research, when we measure some time of visit or something else, so we will calculate was our selection representative, or do we have enough patients, so do we have enough measurements, and produce analysis of the data from statistical perspective. After that, we were able to provide a conclusion about our hypothesis. Was it right or was it wrong? And in the terms of this chart, hypothesis is the same what I'm naming a problem in my spreadsheet. So it's not just a problem, but also problem and solution hypothesis. I'm sure I make a typo in this word, but it doesn't matter. I will shorten it anyway for just a problem because it's too long for this spreadsheet. And I guess you will understand that here I mean that we're talking about what we identify as a problem and what are we proposing as a solution. So I guess it was about general idea how we should make this work possible. Let's take a look on this article about naming itself. It's not that difficult. These suggestions are quite general. Name of the article shouldn't be too short and it shouldn't be too long. I guess making it about, I will just show you good examples. I guess all of you who already entered your titles in this spreadsheet are totally okay with the length of your names. It's totally fine. Okay. So if you have 3 lines, it's too long. If you have 1.5, it's okay. If you have 3 words, it's bad. It will not describe what this article is about, so it will be understandable and it will not require to go through the abstract to understand what's about. Okay, don't use a question in your names. So it's good advice. In lots of articles in common journals, they use questions in titles, but in scientific articles, it's not the best way to do it. So do not use a question. Don't make a complete sentence. This means that you shouldn't make a whole problem and answer for this problem in the title. So it's a bad idea to name article about doctors and telemedicine, that if you have not enough doctors in your clinic, use telemedicine. It's not a best way to name an article. So we should be more analytical in this naming and go with something like the analysis of possibilities to use telemedicine to improve quality of healthcare services with shortage of doctors or something like that. Don't oversell your manuscript. So it's quite easy. If you will name your article that you are solving something, one of the general problems for mankind, it will need really good results in this article. So if you are not really solved a problem about gender inequality, for example, or aging of people, and you state in your title that you are doing it, it will be not a good example. So it should be modest in general. It's not applicable to our studies. Use of keywords that readers will search for. It's a great advice, actually, and titles should be more generally understandable, and it is actually a good advice to check your titles. I guess this one is okay. I saw some article names which should be checked for this. I will advise also not to use abbreviations. So instead of MDs, just use doctors, or on PC should be, I guess, a laptop or personal computer, something like that. Okay. It's okay. I saw in, I guess, areas of interest, some example which was not totally understandable for me. I guess it was already edited and now it's clear. Yeah. So no examples to simplify something in your wording. Okay, I guess you are covering it totally well. Okay, I hope we'll finish with titles soon. Just a few more words about titles. I guess it's all with the titles. Other pages which I was going to show you were not about titles. Okay, if you have any questions about title itself, please ask them, and if not, we will proceed with problem and solution, how we should face them and what's the best. I guess you are totally fine if you will write your questions about titles during my speech about problems, and I will return to them. Okay. I will proceed with problem solving. So, what I was going to say about problems. There are several steps in identification of problem. I guess all of you have something in mind when you specify your area of interest, because you always think about how you will apply your interest to solve something. Maybe you are not you are not so clearly specify this as a problem. So let's start with context. Context will be about where you're going to apply your solution. It's, for example, if we are talking, I will speak about this a bit more. I will cover a bit more about telemedicine today, and it's a good example to speak about context, because telemedicine is a technology with lots of different technological applications and ways of implementation, and it's applicable to lots of areas. And to specify your future work, it's not enough to think only about telemedical technologies, because it's too general. And just to make an example, it's the same as to say that your area of interest is public healthcare in general. So it's not leading us to specifying something closer to a problem which could be solved with this technology. For example, I will stick with my previous example about shortage of doctors. Okay. So in this situation, our context will be related not to a medical problem, but to organizational problem, because shortage of doctor, it's not a medical condition, as you understand, but it's a situation when we do not have enough medical practitioners in our clinic, and our patients have to wait in line for a lot of time, and there will be situations when our patient didn't receive his help in time and his situation worsened, or even it could result in death of our patients. And of course, it is very significant. So context will be organization of medical practice, significance will be if we do not have enough doctors in our organizations, so we will not be able to help all the people who are approaching us for help, and as a result, people will die. Actually, it's very significant. Solution, and it's the most interesting part about specifying a problem. I guess this part with context and significance will be quite easy for you. Solution is the main area of your interest, because during our eHealth course, we are talking about implementation of digital solutions to solve a medical problem, or solution to solve a problem in organization of medical health. So if we are sticking with telemedicine, I guess I should go a bit deeper. I will explain why I'm so obsessed today with telemedicine, because I checked your area of interest a bit closer, and I guess about half of your areas of interests will be in telemedicine. And it's quite interesting for me because in my personal opinion, right now everybody are obsessed with artificial intelligence, neural networks, and something like that. And that you are sticking with telemedicine is very interesting, and I hope that it's related to your understanding of the importance of this technology to improve your medical services and to improve your work. And what will be a difficult part with telemedical technologies? You should be more specific in your title, in your problem, because you are not able to say that our context is lack of doctors, significance is that we need more doctors, and the solution will be introduction of telemedicine. It's nobody will understand how exactly it will help. Yeah, you need to specify what will be the ways that we will use telemedicine exactly. There are several segments or parts of telemedicine. They are not so exactly specified. There are no document which divides these parts. So right now, this technology is only emerging, and in this state, we need to formulate these parts just from scratch. And there could be different approaches how to name the segments. I like this slide and this picture and this parts. For example, it could be patient portals for patients. I'm not sure that it's telemedicine in general, because there are a lot of websites related to patients, but I guess saying that it should be considered as part of telemedicine, it's a good idea, because in many cases, when we face the problem, when we do not have enough doctors and we are unable to reach our doctor to ask him some medical question, what will we do? We will search our problem in Google, in other search engines, and what we will find? We will find some medical portals with a lot of medical data, and if it's just a website which was made without any responsibility, it could lead to disaster, because no one is checking what this website is proposing to our patients. But making these medical portals as a part of telemedical services provided by certain healthcare facilities will lead to for this data available for patients to be more correct, more validated, so we will be sure that our patients, these portals will not make harm for our patients. Yeah, and it's very important from my point of view. Another way of application for telemedical technologies will be personal health applications, and I guess nowadays it's one of the main approaches, and there are a lot of them in our mobile phones, stores, and they are providing patient diaries, some calculators for healthy diets, physical activity, and so on and so on. I guess all of you understand what I'm talking about. And it's also a good part of telemedicine, and you are totally welcome to choose this solution as your specific part of telemedicine. So you will talk about how personal mobile applications could help to some medical condition. I will provide you an example. My previous year student from Russia made a quite good article about mobile applications for allergy control. This mobile applications show on the map where different types of pollen are being are in the air, and patients could adjust their area of living looking at this mobile application and choosing if they should move to another region. And there are really people who are in difficult conditions with allergy, and they need to follow by recommendations of this app. What else? Virtual appointments. I guess it's something which will go into mind when you ask someone on the street about telemedical services. It will be, the answer will be that you are able to see your doctor on a monitor on your phone and talk to him and maybe show something or maybe ask something. So it will be experience which is quite close to our Zoom meeting. Yep. So it's a virtual appointment, and it could be also discussed in such an article how this virtual appointment could help here. And I guess if we are talking about lack of doctors, or when we do not have enough doctors, we do not have enough time with our doctors, this solution will not help at all, because these virtual appointments will occupy the same amount of time as face-to-face meetings. Maybe our patients will save some time, which they take to reach our health facility to go to the doctor to visit him face-to-face, but it will not have doctors themselves. Yeah. What else? Remote health monitoring, and I guess it is the most beneficial solution from telemedical area for our problem when we do not have enough doctors, because blood pressure monitoring, heartbeat monitoring, breathe monitoring, I don't know, we have a lot of devices. Even we have cardio monitors, which will send all the data to the clinic, and if something bad is happening to the patient, doctor will be alerted and will reach this patient with help or something like that. So if we use mobile devices to monitor our health, it will really reduce number of visits to doctor, because there are a lot of conditions, chronic conditions, which require visiting a doctor from time to time just for a checkup. And it could be done at home with telehealth mobile monitoring devices. And another way how telemedicine could be used, it will be doctor-to-doctor consultations. And in many cases, we're totally forgetting about this part of telemedicine. And from our experience in Russia, it's most beneficial and best working part of telemedicine, because it's easy to organize. Different medical facilities have similar conditions. I'm talking about cabinets, computers, cameras. It could be easily adjusted, and from technical perspective, it's much more easy than to make communication to a doctor. There are also issue of trust, and when we are talking about doctor-to-doctor communications, these trust issues could be easily pre-approved by some agreements or something like that. If, for example, if we have a call from, if you are a doctor and you are having a call from your patient in some, by mobile phone from some distant area, okay, it will be a video call in WhatsApp. And this patient start asking you something specific about his health situation. How you will be sure that it's exact your patient and not someone who stole his phone or something like that? If it's not so, if you do not remember exactly how he looked like, or maybe it's not good light in the room or something like that, and there could be a situation when someone will receive the data about medical condition of the patient, which he or she shouldn't receive. So problem of trust is one of the major problems in telemedicine right now. Okay. I guess I gave you some insights how you are able to make your telemedical area of interest more specific and go further from area of interest to exact problem and exact topic of your study. Okay. I guess I was going to show you something else on this thing. I will talk about this a bit later. Okay. 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 So let's make one step back and return to our problem. How to talk about it. So once again, we have a area, we have a significance, why we have something not correctly working in this area, and solution, how exact technical solution could help to improve this area. It's our aim of our publication. It will be aim of our work. Our aim will be to describe how our technical solution will help to solve some significant problem in healthcare area. Okay, we are done with this. Okay. I guess it's quite similar to my previous speech. I recommend you to go through this. I will share this page with you, previous, just for me to remember what I was going to say. And on this page, there are a lot of useful questions. And reading these questions will help you to write your aim and problem in your paper. Where and when does problem arise? Who does the problem affect? What attempt have been made to solve the problem? For example, if we are talking about lack of doctors, we could say that we tried, there were attempts to introduce more doctors to educate students, something like that. So we are able to describe not only our solution, but also compare our solution with other solutions and say that our solution could be cheaper, faster, better, and so on. What's already known about this problem? And this is a very good question, and you will need to cover this in your introduction part. So you will describe previous works on this topic. Is the problem limited to a certain time period or geographical areas? It is about when you specify your country, yeah, and the time period. For example, if you have increase in some disease in a certain period of time, for example, coronavirus was time specific. Okay. How the problem has been defined and debated in literature. It's our literature review when we search for our other publications and analyze them in your work. What will happen if the problem is not solved? It's also a good question, and I recommend to answer this question in the end of your practical task. In conclusion, you need to say that if you will not introduce telemedicine, there will be no way to help more people in a certain areas in a certain time, something like that. Who will feel